left, they were just had tears streaming down their face and they were screaming, and it was really distressing. So it was.
We saw that it was there are really big hospitals and there are really big universities, and there are a lot of rich people there, but the people that we go to don't get that opportunity because they do not get enough money.
It's difficult especially for poor people to go to hospital even their condition is already crisis, and they cannot go in if they don't have any money.
So there was pregnant women who were labouring, and they had the CTG on them, and the midwives would routinely, put it around their abdomens for half an hour and record it, but then couldn't understand, what they were seeing.
Usually the doctors are so overworked that they haven't got time to teach the people who are using it. They come in, they read it, they put it in the thing and go. They haven't got time.
People are so desperate to get health care, so desperate for us to see them.
He has a way. I might not be able to see the solution. So if we look at it with our eyes, yes, it's very, very overwhelming and hopeless. But no, it isn't. It isn't. If you start looking at it with spiritual eyes, it's not hopeless. There's always hope, and there are people that do go, and there are people praying for many of those people. And in God's time, yeah, that hope comes to them.
And I just think of one man in particular, and he grabbed a bit of paper which would say that his wife could be seen, and he was so happy to get that piece of paper, so happy to for the fact that his wife could see a healthcare professional and could get some medicines or get some advice.
In that place, there had been humongous change in the next 12 months after we were there, and the workers and the doctors really had taken on board the messages that we were giving in health education and things in that area really changed. So it was very exciting to say, yeah.
Yeah, that's why we need to go, because they don't get the opportunity that we get.
Medical Boomerang is 3 weeks of outreach for healthcare professionals. We use our skills in medical clinics on the field. This is a unique method of discipling and evangelizing as we practically demonstrate God's heart to heal and restore.